Exercise in studies has been shown to help people with their pain management in endometriosis, even though the last thing that someone probably wants to do. I'm not saying that someone would have to do that on the worst day of their cycle or anything, but all of the other days, that is something that will help. And then now I would definitely be looking at their genetics and also trying to keep their inflammation down, being careful about what they're eating for inflammation, stress, going over some meditation, breathing techniques, things like that. For PCOS, it would depend what their symptoms were, once again, but really trying to manage the blood sugar piece and looking at their genetics and trying to figure out, what their hormone picture is. What is there too much of? What is there too little of? Those are the kind of the two baskets that the Chinese medicine puts things into. And it's really not that dissimilar. Are you estrogen dominant and you don't have enough progesterone? It's sort of the same thing. So just trying to balance all of that out with supplements and herbs. And once again, stress management. People are self-conscious sometimes about their symptoms that they don't feel like they can control. And so really also keeping an eye out for the emotional impact that all of this has on them. Infertility is really hard. Being worried that a whisker is going to show can be really hard. And depending on the age that's happening, it can be, for someone who's in high school or something like that, that can be a really, really big deal. And I'm not saying it's not a big deal if you're in your 20s or 30s, but I think the teenage years are very tender and I feel very protective of that age group.